Hi, I'm Nat from PACOP. Today on Clinical Bites, we are looking at the SAS for care workers and the symptom of distress from bowels. The SAS is the symptom assessment scale, and it is one of the assessment tools we use in PACOP. We have a number of resources to help you get the right SAS scores when you're speaking to the residents. You'll see on the screen we have the ruler, the SAS ruler. We have the form where you record the SAS scores, and we also have an information sheet entitled Your Symptoms Are Important to Us, and that is a sheet we can give to the residents that they can read so that they understand why we're asking about these symptoms every day. The thing to remember with the SAS is we are rating the distress in relation to that symptom. So for the purposes of this session, we are trying to find out how much any problems they have to do with their bowels is distressing them. A good way to ask them about it is to ask them how much it bothers them or how much it upsets them. And a good time to ask them about it perhaps would be in the morning when you're helping them get ready for the day, and perhaps when you're helping them with their toileting. When you're talking about bowels, there can be a number of issues. It can be that they are constipated. It can be the opposite problem. And as we know, that anything to do with the bowels is actually quite upsetting to residents. So it is really good for us to be able to chat about that with the resident and ask them how much it bothers them. Because if we know, we can record it. And if it's in recorded, we can do something about it to help them. If the resident is unable to tell you themselves about their distress levels, then you can score on behalf of the resident by being a proxy. Proxy means that you score on behalf of somebody else. So if you have to score any of the symptoms on the SAS by proxy, what you can do is you can try to rate it through their point of view. Or if their family or friends are there, you can ask the family or friends what they think the level of distress would be for that symptom for the resident. And you can also discuss it with your colleagues. When you're talking about anything to do with bowels, of course, apart from the obvious thing by being constipated or by needing to go to the toilet too much, you can ask them things about their stomach. Do they have stomach problems? Does it feel tight? Does it hurt? Do they worry about going to the toilet? Anything at all in relation to going to the toilet can be rated here. You'll see on the screen we have the guide for proxy scoring. We have the little description about what it is likely to look at if the resident has mild distress in relation to anything to do with their bowels, and that is the green faces. The yellow faces are moderate level of distress or bother, and the orange and red faces are very severe distress. And finally, once you have that information, what we need to do with it is to record it. We need to write it down. We need to then use the ruler to work out how quickly we need to report this score up to the nurse, and use the action plan on the back of the ruler, which is absent, no action, any mild score, report within shift, any moderate score, report to the nurse within 30 minutes, and of course, any severe score, we need to report to the nurse straight away. Thanks for watching this PACOP Clinical Bite, and be sure to tune in and watch all the other clinical bites to do with the Care Workers for SAS Symptom Guide.